All right, we'll go ahead and get the meeting started. It's approximately 6 o'clock right now. Let's go ahead and stand for the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation.
Okay, if we could take the roll call, please.
Mr. Torres?
Here.
Ms. May? Here. Ms. Newman? Ms. Woodruff?
Here.
Mr. Young?
Here.
Mr. Furman? Is not present. Dr. Hans? Mr. Cohen? Present. Ms. Nami Dyer? Here.
Thank you. I believe we do have quorum, so we do have 7 board members here this evening. So we'll move on to approval of board meeting agenda. I get a motion to approve?
Move for approval.
All right, I have a motion. Is there a second?
Support.
All right, support. We just do a voice vote for the approval of the agenda?
Sure.
Okay. All right. All those in favor?
Aye.
All right, we'll move on to public comment. Do we have anybody in public comment?
We do not have any public comment in the online form or in the chat, and currently no one in the room for public comment, but we do have a second opportunity at the end of the meeting for public comment.
Okay, thank you. There's nobody in the room or online that would like to speak in public comment, but there will be another opportunity at the end of the meeting. So we will move on to the next business of the board officer elections. So we have several, our annual organizational meeting for various appointments to positions here on the board. So this is the way that we will operate it. So we will take a nomination. I'll go through each position individually, take a nomination, and then there would have to be a second, and then the person who is nominated would have to accept the nomination, and then there would be a vote individually. So if there are more than one person, for example, nominated for board chair, then we would take each individually and vote on them individually. So we'll move forward. And for the record, I'll note Dr. Hans is now here in attendance for the board meeting. So I will move on to, and Adam, Mr. Firm is here as well. So we already established that we had quorum, but we have 2 + 2 board members as well now. Okay. So we'll go ahead and move on to the board officer elections. So board chair will be first. Do I have any nominations for board chair? Dr. Hans?
I nominate Mr. Dennis Cohen for president.
All right, Mr. Cohen.
Chair.
Okay. Mr. Cohen has been nominated for president. Do I have a second on that nomination?
I'll second that.
Okay. All right, Mr. Yun has seconded that nomination. Okay. Do I have any other nominations for board chair?
Pardon me, Mr. Torres.
Yep.
Actually, under Robert's rules, a second is not required when taking nominations from the floor.
Okay, so we do not require a second. So we have a nomination of Mr. Cohen. Do I have any other nominations for board chair?
I nominate Jonathan Landsman for board chair.
Mr. Landsman has been nominated for board chair. Do I have any other nominations for board chair? All right. So my next move would be to assure that each individual accepts that nomination, correct? Okay. And so does Mr. Cohen accept that nomination?
While I am very honored to have the nomination, I'm going to not accept it, and I'm going to defer to Mr. Landsman.
Okay. All right. And Mr. Landsman has indicated to me that he would accept the nomination if he received it. So he does accept the nomination even though he is not here. So right now I only have one person who has been nominated and accepted. So now I would need a second for Mr. Landsman. Nope, I don't need a second. No, we can just vote individually. Okay. All right, so we don't need a second. Okay, so again, any other nominations for board chair? All right, we'll call it to vote, and we will have to have a roll call vote. So if you could please call the roll.
Okay. Mr. Torres?
Yes.
Ms. May?
Yes.
Ms. Newman?
Batteries died.
Okay.
They don't want me to vote, that's fine.
You can just vote verbally, I guess, for now, so that fixes it.
No.
Ms. Woodruff? Mr. Young?
Yes.
Mr. Furman?
Yes.
Dr. Hahn? Mr. Cohen?
Yes.
Ms. Nemi
Yes.
Motion carried.
Motion carries. Okay, so Mr. Landsman has been elected board chair. So we will move to our next officer position, board vice chair.
What was the vote?
Oh,
The number of votes?
Yes, what was the total number of votes?
7.
Okay, 7 in favor?
7 in favor.
7 to 9, right? Was it 7 to 9? Okay,
7 and 9.
7 to 2.
or 7 to 2.
Yeah, 7 to 2.
Okay. Okay, thank you.
All right, the nomination does pass by voice vote or by roll call vote 7 to 2. Okay. All right. So we'll move on to vice chair. Do I have any nominations for vice chair?
I'd like to nominate John Paul Torres for vice chair.
Okay. Do I have any other nominations for vice chair? Okay, no other nominations that I'm seeing. I do accept the nomination for board vice chair. So we will bring it to a vote. If you could please call the roll.
Mrs. May? Ms. Newman?
Yes.
Ms. Woodruff? Mr. Young?
Yes.
Mr. Furman?
Yes.
Dr. Hahn?
Yes.
Mr. Cohen?
Yes.
Ms. Nemi
Yes.
Mr. Torres?
Yes. Okay. All right, the nomination does pass, 9.
9 out of 0.
9 in favor, okay. Okay, we will now move on to our treasurer. So I'll open it up for nominations for treasurer. Melchiah?
I'd like to nominate Mr. Cohen.
Okay, all right, we have a nomination of Mr. Cohen. Any other nominations for board treasurer? Okay, don't see any, so I will go ahead and, Mr. Cohen, do you accept the nomination?
Yes, I do. Thank you.
Okay. All right, Mr. Cohen has accepted. If we could take a roll call vote, please.
Mrs. May?
Yes.
Ms. Newman?
Still not working.
Yes.
Uh-huh.
Ms. Woodruff?
It is.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Dr. Hans?
Yes.
Ms. Nami Dyer?
Yes.
Mr. Cohen?
Yes.
Mr. Torres?
Yes.
9 out of 9, approved.
Okay. All right, now we will move on to, board secretary. Do I have any nominations for board secretary? Okay, Mr. Cohen? Okay, Mr. Furman has been nominated. Do I have any other nominations for board secretary? Okay, Mr. Furman, do you accept?
I accept, yes.
Okay, Mr. Furman does accept. And we will do a roll call vote.
Mrs. May?
Yes.
Ms. Newman?
Yes.
Ms. Woodruff?
Yes.
Mr. Young?
Yes.
Dr. Hans?
Yes.
Mr. Cohen?
Yes.
Ms. Nami Dyer?
Yes.
Mr. Torres?
Yes.
Mr. Furman?
Yes.
Approved, 9 out of 0.
All right, thank you. So that fills all our executive positions for the executive board. We will move on to our standing committee appointments. So we would need a vice chair for our finance committee appointment. Do I have any nominations for vice chair to finance committee?
Not vice chair, but just a question.
Okay, go ahead, Ms. Newman.
If I remember correctly, don't we ask people if they want to switch their committee prior to the vote?
Yeah, I think we do. So I guess that would be in order, because you'd have to be on the finance committee to be the vice chair. Are there any individuals that want to not, or want to switch the committee that they're assigned to at this time? So move from one committee to another, or swap out at all? Are we to a capacity on both committees with everybody? Do we know?
I'm unsure.
I wasn't sure if there was room on one committee over another.
Was Dr. Taub a member of any of the committees?
I think he was, do you know what that, was he on policy? Okay, so there would be one on policy.
Okay.
I think it's color-coded on the sign-in sheet.
Oh, is it? Okay. So he'd be on policy. So we would have room on policy. Well, technically, Dr. Taub is still,
Is still a member of the committee.
the board. Yeah, would still be a member of the committee. Was there anybody that wants to move? Let me ask that question first. Is everybody okay with where they're at? Because if not, then it's kind of a moot point. Okay, all right, I don't see anybody that wants to move, so we'll stay where we're at on the committees. But thank you, Melchiah, for raising that point. So we will go to the Finance Committee appointments. Vice Chair of the Finance Committee, do I have any nominations for Vice Chair? Okay, Mr. Cohen? Okay, Mr. Young has been nominated to continue as Vice Chair. Any other nominations for Vice Chair? All right, seeing none, Mr. Young, do you accept the nomination?
Yes.
Okay. All right, if we could do a roll call vote, please.
Okay, Mrs. May?
Finance. Oh, yeah, yep. Get the sheet, yeah.
Yeah.
So, Mr. Young?
Yes.
Mr. Furman?
Yes.
Ms. Neva Dyer?
Yes.
Mr. Cohen? Yes. Mr. Torres?
Yes. All right,
Approved,
okay.
5 out of 5.
5 out of 5, so we are approved. All right, now we'll move on to Policy Management Committee appointments. So if you're on the Policy Management Committee, we will need a committee chair appointment. So do I have any nominations for committee chair appointment? Okay, Ms. Newman?
I would nominate myself.
Okay, Ms. Newman has nominated herself. And is there any other nominations for chair appointment for the Policy Management Committee? All right, and then you would obviously accept. So we will move on and do a roll call vote.
Ms. Woodruff?
Yes.
Dr. Hans? Yes. Ms. May? Yes. Ms. Newman?
Yes.
4 out of 4 approved.
Okay. All right, 4 out of 4. All right, and now we would need a vice chair appointment for the Policy Committee. Do I have any nominations for vice chair? And you do have to be on Policy Committee in order to nominate somebody, correct? Okay. All right. So we need a vice chair. Does anybody want to step up or oh, Ms. Malkaya?
I'd like to nominate, Ms. Woodruff.
Okay. All right, Ms. Woodruff has been nominated for the vice chair appointment. Are there any other nominations? All right, Ms. Woodruff, do you accept?
I accept.
All right, thank you. All right, we will do a roll call vote, please.
Dr. Hans? Yes. Mrs. May? Yes. Ms. Newman?
Yes.
Ms. Woodruff?
Yes.
Approved, 4 out of 4.
Okay. All right, thank you. All right, thank you, everybody, for your service and stepping up. We will move on down to committee representatives. So the Recipients' Rights Advisory, I think Ms. Root is right now the representative, if I'm correct. Does anybody know what her intentions are? Does she want to stay on, or does anybody want to nominate anybody for that position?
I would nominate Ms. Root if she was here. I'm not sure how she would accept, but she does a fantastic job.
Right. If she's not here, though, and we don't know if she's accepted, we can't move forward, correct?
Correct.
Okay, right, so, yeah, she can't accept, so we can't move forward with a nomination for her, unfortunately. So is there anybody else that would be interested, in the recipients? I know she's very good at it. It's something that, I served on it as well, and I enjoyed it very much. I think it's, a very good group, and committee. Any nominations? Okay. Ms. Hans? Okay. Dr. Hans? Okay. So, Dr. Hans, has, up for nomination, is volunteering. Is there anybody else who would be interested? Okay, so Dr. Hans, you obviously would accept the nomination, so we'll move forward with a roll call vote on that.
Mrs. May? Yes. Ms. Newman? Yes. Ms. Woodruff? Mr. Young?
Yes.
Mr. Furman?
Yes.
Mr. Cohen?
Yes.
Ms. Nami Dyer?
Yes.
Dr. Hahn? Yes. Mr. Torres?
Yes.
Approved, 9 out of 9.
Okay, all right, let's move on to Citizens Advisory Committee. Who, currently serves on Citizens Advisory? Okay, all right, would you like to continue? Okay.
I will nominate,
Okay. Mrs.
the
Nomi Dyer?
current,
Yeah.
the current holder of the
double name,
office.
yeah, Rita Diamond.
If somebody's willing to
Nomi Dyer.
continue,
Yep.
let's not make a mistake and,
Okay,
all right.
All right, anybody else, any other nominations for the Citizens Advisory Committee? All right, seeing none, and, you have obviously accepted, so, we'll just move forward with roll call vote, please.
Okay. Ms. May?
Yes.
Ms. Newman?
Yes.
Ms. Woodruff?
Yes.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Dr. Hans? Yes. Mr. Cohen?
Yes.
Ms. Nami Dyer?
Yes.
Mr. Torres?
Yes.
9 out of 9 approved.
All right, excellent. We'll move over to, the Substance Use Disorder Oversight Policy Board. Mr. Cohen, I think you currently serve on that?
I do, and I think I got my hands full with treasurer, so I would like to nominate Ms. May. The meetings are only quarterly, so would that be acceptable?
Absolutely, thank you.
Okay, you're welcome.
Okay. Any other nominations? All right. Okay, let's move forward with a roll call vote, please.
Ms. Newman?
Yes.
Ms. Woodruff?
Yes.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Dr. Hans? Yes. Mr. Cohen?
Yes.
Ms. Nami Dyer?
Yes.
Ms. May?
Yes.
Mr. Torres?
Yes.
9 out of 9 approved.
Okay, excellent. Thank you, everybody. So that concludes that portion of our agenda. Now we'll move over to our board vice chair executive report. So that will be me. So I have a report that's been prepared by Mr. Landsman that he has provided for me to read. So I will go ahead and move forward with that. The executive board committee, so the executive committee meetings are now held prior to the study sessions monthly. This recent meeting was held on Thursday, September 29th at 5 p.m. prior to the CMHA Tri-County Metro meeting. The full executive board attended along with the CEO, COO, CLO, and CCO. We finalized the agenda for this month's October Committee of the Whole meeting, the general board meeting, and the study session. The executive board voted to provide preliminary support for the MORC training contract. The CMHA Tri-County Metro meeting on Thursday, September 29th was held at 6 p.m. We hosted it. Topics included updates by the 3 PIHPs, CMHSPs, CEOs, and activities, advocacy, and upcoming election. A thank you to Alan Bolter from the MCMHA for his in-person briefing. We have a lot of acronyms. The election is Tuesday, November 8th, covering U.S. House statewide proposals along with state and local officials and local proposals. Party politics aside, remember your vote is your voice. Thank you. And I did want to add a statement with regard to Dr. Taub. He has put forth his resignation from the board. It has not been accepted yet, so he technically still is a board member. But he did, I believe we were all forwarded the email that he had sent to the county commission where he speaks of, you know, that it was a great honor for him to serve on this board, that he has really, you know, felt strongly about serving on the board all these years, the past 20 years, and that, you know, he's sad to go. But he would like us to move forward and appoint somebody new to replace him so that we could be at full strength and full capacity. And I'll say on a personal note, I've known Dr. Taub going back to about 2009 when I first got appointed to the, back then it was the Community Mental Health Board. And, you know, he's always been somebody who's been very involved with OCHN, with board activities and being involved at the state level. He served with the state association and even received the prestigious Hal Madden Award during his time on the board. He's always been active in going to all of the conferences over the years. I've enjoyed serving with him. I've been able to learn a lot from him. I haven't always agreed with him. Our politics are different, but that aside, he's always been, I've never questioned his passion for what he's doing and for serving on this board and being here to advocate for what he does. So it's sad to see him go with all that experience, all of that knowledge, he's a University of Michigan fan, as am I, so I would say go blue to him. But it was an honor as a board member back in 2009 to 2011 when I served on the board, and then coming back in 2018 to at least the current time now, since he's left, to be able to have served with him. So thank him for his service. I am thanking him for his service.
Mr. Chair,
Yep.
do we need a motion to accept the resignation?
I don't think, I would defer to Mr. Hooper, because I do believe it's the county commission that has to accept his resignation,
Okay.
not us. Mr. Hooper, it is the county commission, correct, that has to accept his resignation, not us, correct?
Okay.
Yep.
Could I, just a moment of
Go
personal
ahead.
privilege. I have known Steve Taub for over 20 years, and his wife Shelley. They're both outstanding public servants. It's with deep regret that I saw his resignation, because I think, as you have mentioned, his passion for the people that we serve is unmatched. Being a physician, he had that Hippocratic oath of always doing no harm and always trying to improve a situation. He brought that to the table here, and I think his experience and his passion will be deeply missed. And I understand why he is resigning, and certainly that is very, very hard for him to make that final decision. But we will always remember him fondly, and I hope there'll be a point that someday in the near future he can come to a meeting and accept our thanks personally.
Yeah, excellent. And I do know that we plan on providing him with a plaque for his service. So hopefully at some point we'll get there where he'll be able to come and we'll be able to present that to him in person. Or maybe even via Zoom if we have to. But I will move forward, and if anybody has anything else to say with regard to Dr. Taub, we can do it in our board comments at the end, if you should so choose. We'll go on down to our Finance Committee Vice Chair report. Mr. Young.
Thank you. We had an exciting start to the Committee of the Whole meeting. I want to thank my two attorney friends for guiding us through till we got a quorum. We heard reports first, and Christine wins the prize for helping us get to our half-hour mark where we had a quorum. So publicly, thank you for doing that. Kind of overall, the Finance Committee recommended all presentation items to move forward to the full board meeting. We'll see those under approvals. Edna White did a great job with the employee benefit presentation and PA 152 resolution, which I learned a lot about from that conversation. Also, we'll have the MORC training contract come forward, as well as the cobblestone contract.
All right. Thank you. We will move forward with our August financial review. Ms. Allison? Is she here, or is she online?
And I'm online tonight. I apologize for not being there in person. Can everybody hear me okay?
Yep, we can hear you.
Okay. You can go to the first slide, please. So you're looking at the most recent revenue trend for August. You can see it did jump up there for both August and September. Having that just happen, I do want to look into who those eligible people are that are causing that jump in revenue, because we didn't expect that necessarily. So we'll dig into that a little bit for future months. So you can jump to the eligible trend, so you can see there That is what's driving that increase in revenue. So the best I can guess right now would be it's due to CCBHC and an uptick of those people being enrolled and being served. But we'll look into that more specifically to determine where that's coming from. Next slide, please. Okay, so this is our assets, and we are looking at the end of fiscal year 21 versus August of 22. So you can see investments are up, receivables are a bit down, other assets are down slightly, and then capital assets are down slightly with just depreciation. Liabilities, you can see liabilities are down significantly from the end of the fiscal year, which is typical. Due to state is down. Employee payables is a bit up, and then long-term debt again is down due to depreciation. So net position compared October 1st through August 31st, total assets are up. Liabilities are down, so our net position has increased. Revenue comparison is year over year. So this is August of last year compared to August of this year. So you can see that that's up just under $30 million, and that's a large chunk of that is going to be CCBHC. General fund is nearly the same. County funds is roughly the same, and then all other is up. And I apologize. All other is currently where CCBHC supplemental payment is hitting. The Medicaid revenue is up due to eligibility in Medicaid fund source. Expense comparison, administration is up. Part of that is an adjustment in how we were classifying some of the administration. Provider network is up pretty significantly, all of which we planned for, pushing out additional money in fiscal year 22. Grants is up slightly, and that just fluctuates with the grants that we have each year. And then all other is very difficult to see on that slide, but is roughly the same. So that leads to total revenue compared last year this time to this year is up by about $40 million. Total expenses are also up by a bit more. So our net income is down compared to last fiscal year, all of which is planned and not unexpected. So these are our top 15 providers, and then the next slide shows you what we paid each of those providers. Or it doesn't. Usually there's a slide that tells you how much we paid each of them. Not sure why that's not in there, but we'll get that corrected for next month. And with that, I can take any questions.
All right, any questions, anybody?
Just a quick
Go ahead,
comment,
Ms.
that
Lazenby.
comparison is in the packet on you, just can't see it.
Okay.
Yeah.
Great. Thank you.
All right, any questions from anybody? I just had one thing, with regard to the grants, and I don't need to know now, but maybe like later somebody could email it to me, the list of grants that we have, that we receive, just, because I'm not quite sure what I know some of the grants are, but I don't know all of them, so I'd just be interested in knowing that.
So the full list of grants is listed in our annual plan for fiscal year 22, and then now with 23, they're all listed in there as well.
In the annual plan, okay, I can look.
But I'm sure we can send that to you if you'd like.
Yeah. Okay. Anybody else with anything? All right, thank you.
Thanks.
We will go ahead and move on. So board approval of the 2023 board calendar. And do we have to take a roll call, or do we just do we do a roll call vote for it? So I know we looked at it at the last meeting as well at our committee of whole. Did anybody have any objections to the board, calendar? Okay. All right, I know that's always a tricky.
John Paul,
Go
sorry,
ahead.
no
Yep.
objections, but I think I remember, Sheila mentioning that there was one or two dates that we actually had to decide between and then vote on those. I don't have it in front of me, but
Okay.
I don't know if anybody has that.
What was it, the 20? Oh, okay, for the, study session, is that what it was? So the 22nd or the 29th? Right, was it, because there were an extra Thursday in there, is that what it is? Okay,
I think it's because the same week has the third Tuesday and the fourth Thursday of the month. So if we did the 22nd, we would have two board meetings that week, but if it was the 29th, then it would split it up.
do we have any preference on what we want to do? What was, any suggestions? Okay, go ahead, Melchi.
I suggest the 29th, so we don't have to have two meetings in
Okay.
1 week.
In 1 week. All right, anybody else? Proceed with then, doing it on the 29th, so we don't have to have two meetings in 1 week. All right, okay, so we have to vote on that, though. Do we have to vote on that as a change or to our calendar?
We can do,
I'm sorry?
it doesn't have to be a roll call, it can,
We can just
Yeah,
voice vote on it? Okay.
But before we vote,
Mm.
we got some other ones highlighted too. August 7th, first Monday, 21st of December,
Yeah, so,
Friday, so correctly.
December 30th. Have it. Sorry. So we have a couple other highlighted ones for board study session, May 25th. And then we said the June, we already did the August, first Monday. Does everybody have a copy of the calendar that they can look at in their packet? So you should be able to see it. So those dates you have highlighted, so like that November date, that's the 30th, which is the fifth Thursday. I think that would be between, that would be after, Thanksgiving, correct? So we would be meeting, assuming the Thanksgiving would be the week before? Okay. So does anybody have any objection to that date, the November 30th? Okay, and then December 21st, which is a Thursday, the third Thursday, so that gets up close to the holiday, but it still is 4 days before Christmas. Anybody have any objections to that? Right, yeah. But the thing is, I think because we would do the two meetings that week as opposed to, not meeting in between the two holidays, between the Christmas and New Year's. So, and if the study session, if we have nothing to do for the study session, we could always, not have it. So that seems like it would probably be the best, even though it's gonna be one meeting after another. Does anybody have any objection to that? Okay. What about the, August 7th, which would be the first Monday, that's highlighted as well. I don't see where there'd be any objection to that. Okay, yeah, it's normally the second Monday, so this would be the first, 'cause it's a little later. So that way we're not having another meeting. So that seems to make sense, right? Correct? Anybody have any issues with that? And then, again, May 25th, 25th is highlighted as well, and that would be the Thursday, the last Thursday in May. Is there any objections to that? So we do want to continue with the 29th then, correct? That was the consensus, correct? So in June. So okay. So we'll go ahead and make that amendment to reflect in the calendar June 29th as opposed to June 22nd. All other dates in the 2023 public meeting board calendar would remain the same. So I guess I would need a motion to that effect, and then a second, and then a roll call vote.
I move to approve the calendar for 2023.
Do I have a second?
Second.
Okay. Mr. Young, all right. And then Ms. Malkai, did you have something to say?
I was gonna make the motion.
Okay, all right, made motion. Okay, we have a motion and a second. All right, let's do roll call, or we don't have to roll call vote. All those in favor, say aye. Aye. Okay. Any opposed? Okay. All right. Thank you. So we have adopted our calendar. Let's go down to Ms. Lazenby, the CEO succession plan.
During the CAL last week, I did present the CEO succession plan. So I'm not sure if there were no questions last week. I'm not sure if anybody has any new questions this week. It does name Mr. Genovi as my successor in the event that I'm unable to perform my duties or I have a temporary leave of absence.
Any questions from Ms. Lazenby on that? And this is something that we have to approve. Do we, is it a roll call vote? Okay. All right. If we would need then a motion and then a second, and then we'll do a vote.
I move to approve the CEO succession plan.
Okay, Mr. Firm has
Support.
made a motion. Ms. Newman has supported it. Any comments or questions or statements? All right. Let's go ahead and move forward with a vote.
Mrs. May?
Yes.
Ms. Newman?
Yes.
Ms. Woodruff?
Yes.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Dr. Hans? Mr. Cohen?
Yes.
Ms. Nami Dyer?
Yes.
Mr. Torres?
Yes.
Approved. Motion carried.
All right. Thank you. So we'll move on to the cobblestone contract. Ms. Ali?
Good evening, Kalana Ali, Chief Legal Officer for OCHN. I did present this at the CAL last week, requesting a 4-year approval at a proposed contract amount of $559,451.39. This is a contract request for a contract management and procurement system. This request is following a competitive bid process that was completed and by our procurement and relevant committee members. Following the review, this is the outcome of their recommendation, and so I am available to answer any questions that the board may have at this time.
All right, do we have any questions from any board members on the contract? All right, I don't see any questions. So we could move forward if everybody's in agreement. We can vote on the cobblestone contract if I have a motion.
Move for approval.
Okay. Do I have a second?
Support.
All right, it's moved and supported. Okay, we can vote, and it would be a roll call vote.
Mrs. May?
Yes.
Ms. Newman?
Yes.
Ms. Woodruff?
Yes.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Dr. Hans? Yes. Mr. Cohen? Yes. Ms. Nami Dyer?
Yes.
Mr. Torres?
Yes.
Motion carried.
All right, thank you. We'll move on to PA 152 resolution. Ms. White?
Good evening. At last week's Committee of the Whole meeting, I presented information about the OCHN Employee Benefit Plan, and that was in conjunction with a request for our organization to opt out of the provisions of Public Act 152 for the upcoming benefits plan year 2023. As part of that presentation, I provided demographic information about our organization. I gave a summary of our healthcare plan structure and identified next steps, including board approval of the opt-out resolution. I will do a follow-up. I believe Ms. Woodruff had a question about the average employee tenure. I was able to determine that to be 6.5 years. So I wanted to give you that follow-up information. And with that, I am prepared to answer any questions ahead of your vote.
Okay, thank you. Do I have any questions on the resolution? Go ahead. Dr. Hans?
Yeah, I was not present at the committee of the whole meeting, but this may have already been discussed. Is this benefit extended to all employees, and if there are any part-time employees that also benefit from this program?
This particular package is extended to our full-time employees. However, we do abide by the requirements of the Affordable Care Act, and if we have part-time employees who exceed an average of 30 hours per week, then we extend the health care benefit to them as well.
Okay. And my follow-up question is roughly the percentage of part-time versus full-time employees?
I have that information. It was in last week's presentation. I'm sorry, I don't have it off the top of my head.
That's all right. Thank you.
But it is in the board packet from the Committee of the Whole.
Thank you.
Mm-hmm.
And we can access that in Boardable, so we'll be able to get that. Okay. Any other questions for Ms. White? PA 152, okay. All right, thank you, Ms. White. Let's go ahead and need a motion to accept the PA 152 resolution.
So moved.
Mr. Yun has moved and support.
Support.
Okay, Ms. Newman has supported. Go ahead and any questions or comments? Any further comments? Move forward with a vote. Take the roll.
Mrs. May? Yes. Ms. Newman?
Not working.
Yeah.
Okay.
Ms. Woodruff? Mrs. Young?
Yes.
Mr. Furman?
Yes.
Dr. Hans?
Yes.
Mr. Cohen? Yes. Ms. Nami Dyer?
Yes.
Mr. Torres?
Yes.
Motion carried.
All right, thank you.
Thank you.
Okay, we'll move on to the OCHN benefits package. Ms. White.
I'm back. At the Committee of the Whole, I did do a comprehensive presentation on the structure of our benefit package. We are not planning to make any changes to our benefit package for the 2023 plan year due to the favorable quotes that we received when we bid out our package. So with that, I am prepared to see if you have any follow-up questions from last week's presentation.
Any questions from any board members? Okay, Ms. Newman?
I was not at the presentation at the committee of the whole. Sorry, I missed it. But I'm just curious, how many bids did you receive for the contract?
I'm not familiar with the entire, number off the top of my head, but I want to say it went out to about 6 different organizations, United Healthcare, Priority Health, some other plans as well. We don't do that in-house. We have a contract with a benefits management agency. We work with Assured Partners, and they use their expertise to do the bid on our behalf. But we did receive a comprehensive report back, and I sat on the evaluation committee in addition to our chief financial officer, our chief legal officer, and we made a decision to maintain the same plan that we have.
All right, excellent. Anybody else? Any other questions? All right, we will move forward with a vote on the benefits package. A roll call. We'll need a motion and then a second. Sorry.
So moved.
Okay, Mr. Young has moved. Do I have a second?
Seconded.
All right, Ms. May has seconded. Okay, any comments? Any additional comments? Questions? Okay. All right, let's move forward with a roll call vote, please.
Mrs. May? Yes. Ms. Newman?
Yes.
Ms. Woodruff?
Yes.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Dr. Hans? Yes. Mr. Cohen? Yes. Ms. Nami Dyer?
Yes.
Mr. Torres?
Yes.
Motion carried.
Thank you. All right, we'll move down to the next item on the agenda, which is the OCEU IBEW Union Collective Bargaining Agreement. Ms. White.
Mork.
Oh, Mork, I'm sorry. Let me go up to item F, Mork Training Contract. Ms. Zuzumbo.
Hello, good evening. I'm sorry I wasn't able to join in person tonight. This is the contract that we presented on last week regarding our extension of the MORC training contract as we continue to build out our curriculum to launch our LMS to the network. Do we have any additional?
Yeah, I was going to ask, were there any additional questions? I know you went over the information at the committee of the whole, but were there any clarifications or additional questions that we had on this contract extension? Oh, Dr. Hahn?
The question I have is about the format of these trainings, because some of the direct care workers that I have heard from indicate that they would benefit from in-person didactic lectures, presentations where they can have interactions. Now, during COVID, almost all the training was on Zoom or virtual. So I want to know if these trainings can be done on site, and what would be the venue. I think we have in this building enough space and facilities to do the training, and I think that was at one time discussed in the past. So I'd like a little more information on that.
Sure. We are working with a focus group of providers. A good portion of the training will be done via the learning management system, which is the same system that you use for your trainings here at OCHN as well. This will help to eliminate some barriers with transportation, along with time to get into a training to register so that they are able to serve the people that that we serve. There will be still trainings that will be held in person. the trainings we have slated for that will be the medications, the CPR, first aid, health skills assessment. And we'll continue to assess what is the outcome of those trainings so that we can make adjustments as needed.
Thank you. Any other questions? All right, seeing no other questions, let me move forward with I would need a motion and then to approve, and then support.
Move for approval.
Okay, it's been moved by Mr. Young.
Support.
Support by Ms. Woodruff. It's moved and supported. Any comments? Move forward with a roll call vote, please.
Ms. May?
Yes.
Ms. Newman? Ms. Woodruff?
Yes.
Mr. Young?
Yes.
Mr. Furman?
I am abstaining given my role at Mork.
Noted. Dr. Hahn?
Yes.
Mr. Cohen?
Yes.
Ms. Nami Dyer?
Yes.
Mr. Torres?
Yes.
Motion carried.
All right, thank you. Now we'll move down to item G, the OCEU IBEW Union Collective Bargaining Agreement. Ms. White.
All right, good afternoon. Again, I'm back. This time seeking approval for the agreement with the Oakland County Employees Union affiliated with the International Brotherhood of Electrical Workers, Local 58. The tentative agreement was ratified by the union membership last week. You should have a copy of the agreement in your confidential section of the board packet. I should let you know that this would be a 3-year agreement effective November 1st through 9/30, November 1st of this year through 9/30/2025. We cannot formally execute the agreement without board approval. So at this point, I will see if anyone has any additional questions.
Okay. Any questions from any board members on the contract?
I have one question. I'm just wondering why it's not for a full number of years and just odd months.
Normally, it would be effective 10/1. However, due to the time that it took to finalize the agreement and the actual ratification, that timing took us into the month of October.
Sure.
Therefore, we want to make sure that if the board were to approve the agreement, we'd have time to take care of the administrative portions of the agreement.
Thank you.
Welcome.
Yeah, it is available and boardable. Go ahead, Ms. Newman. Did you have something? No. Okay. Okay. Yeah. All right. Anybody else? Any questions? Any other? Okay. All right. I would need a motion, please.
Move for approval.
Do I have a second?
Seconded.
All right. Ms. May, I'll accept your second. Any comments or other inquiries? We'll go to a roll call vote, please.
Mrs. May?
Yes.
Ms. Newman?
Yes.
Ms. Woodruff?
Yes.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Dr. Hahn? Mr. Cohen?
Yes.
Ms. Nami Dyer?
Yes.
Mr. Torres?
Yes.
Motion carried.
Thank you.
Thank you. All right. Let's move on to the recipient's rights appointment. Ms. Suter?
Good evening, Vicki Suter, Director of Rights and Advocacy. Our RAC committee met on October 5th, and we did an interview of Sylvia Clark. Unanimously, our RAC committee voted to recommend Ms. Clark to be appointed to the RAC committee. We have one position available. If she is appointed tonight, that will complete our, we'll have a full committee, which is nice. Ms. Clark was previously a part of the RAC committee. She had served 2 terms, which means she was on the RAC committee for 6 years. She was in good standing. She participated. She attended meetings. She was an asset to the committee. She's been off for a couple years, and so she meets the requirements to be considered for a 3rd and final term. So we're asking that the board approve her to the RAC committee.
Okay. Thank you. Any questions at all for Ms. Suter? All right. Okay, we have a motion to move for the appointment. Do I have a second?
Support.
All right. All right, Ms. Newman has seconded. Any other, okay, any comments or questions at all from Ms. Suter on this appointment? None? Okay, all right. Can we do a voice vote or
Roll call.
roll call? Okay, please call the roll.
Ms. May?
Yes.
Ms. Newman?
Yes.
Ms. Woodruff?
Yes.
Mr. Young? Mr. Furman?
Yes.
Dr. Hans? Mr. Cohen?
Yes.
Ms. Nami Dyer? Mr. Torres?
Yes.
Motion carried.
Okay, thank you.
Thank you.
Okay, we'll move forward with the consent agenda, board approvals, the September 20, 2022 board meeting minutes, and the acceptance of the meeting minutes reports from the Recipients' Rights Advisory Committee of September 2022, Committee of the Whole minutes, September 12th, 2022, Citizens Advisory Committee, September 21st, 2022. Can I have a motion to accept the consent agenda?
Move to accept.
I have a second? Support. Okay, any questions or comments regarding the consent agenda? Seeing none, voice vote on this. All those in favor, say aye.
Aye.
Aye. Okay. Any opposed? All right, let's move forward. Other business, board reports. Recipients' Rights Advisory Committee, Ms. Root, she is not here. I don't believe, does anybody have her report at all, or? Okay, I don't see anybody with it. So Ms. Root is absent this evening, so there is no report from her. We'll move on to the Citizens Advisory Committee, Ms. Nami Dyer.
Yes, good evening. The CAC met on September 21st at 9:30 a.m. We had a presentation a discussion by Mark Jones, a customer services specialist, where he discussed and reviewed the CAC bylaws and just kind of provided some updates and information regarding the voting process. Because the chair and vice chair nominations and elections will be coming up in November. So members will be voting for those positions from the floor. Self-nominations are accepted, and members are allowed to have discussions before that meeting in order to state their interest to accept nominations. And virtual meetings and virtual voting are permitted for the CAC. Of note, during this meeting, we also had a presentation by Craig Bolian. He is the manager for MyCal, which is the Michigan Crisis and Access Line. So this is the 24/7 statewide crisis support information and referral line. And he discussed the 988 program, which is for all persons living in Michigan. It is meant for people in crisis or distress and don't know where to turn. And it is a warm line for people who need somebody to listen to them. MDHS does contract with Common Ground for this to staff both MyCal and the Michigan Warm Line. So just he did give kind of a reminder that 988 is the new 3-digit dialing code for the National Suicide Prevention Line, and it is active across the U.S. So this is for mental health and substance abuse emergencies as well. When people utilize this 988, they are connected to trained counselors who are part of the existing Lifeline network. The trained counselors will listen and help kind of understand how the problems are affecting them, provide support, and connect them to any other resources if necessary. He went on to kind of discuss that there are it involves two other programs because part of it is an actual phone line that is just for calling, but that there is also a chat and text resource and crisis helpline. And then there is a backup center for the 988 phone line. He did indicate that the volume of calls since mid-July has kind of drastically increased. In July, there were almost 5,000 calls, with each having an average of 23 seconds in duration. That was the majority of the discussion, so that is my report.
Thank you. Thank you for your report. Do we have any questions on the report? All right, we will move on to public comment. The second option for public comment. Do we have anybody online or in person that would like to speak in public comment? Sir, if you could come forward, please. Yep. You can go ahead and sit there. If you could, please, sir. If you could just introduce yourself, sir, and state your name.
Sure. My name is Douglas Wolf.
Okay, go ahead, Mr. Wolf.
Okay, thank you. My wife made a public comment at the last board meeting on September 20th, and she's not able to be here live tonight. There were a lot of positive comments and sincere appreciation. Since then, I'd like to provide an update on what has happened with our son, who is 15 years old, and he is on the SED waiver. As background, he has been on the waiver for the past number of years, and we have received very limited services. We routinely need to check our son's bedroom for safety purposes due to self-harm and suicidal and homicidal threats. 2 days after the last board meeting, when searching his room while at school, my wife found in the open dresser drawer, waiting to be found, a pocket knife with a 4-inch blade in his glasses case, along with a sticky note with the words, "F you, Mom and Dad," the actual word. The blade had dry blood on it, very likely from self-harm. After many years of describing in detail how he would kill our family one by stabbing us, you can imagine how alarming this was for us. He is a good kid with a troubled mind. We were able to get our son to the emergency room that day. He was in the ER for 2 days while my wife worked frantically to find placement for him. Only by the help of a highly experienced advocate and a state legislator, we were able to get our son to Pine Rest in Grand Rapids via ambulance ride across the state. He spent 1 week there, and he repeatedly told us he would do and say whatever he needed to get out of there. While there, again, we were strongly recommended by professionals that our son be placed in a longer-term facility and eventually in a residential group home or therapeutic foster care. We are told time and again for our safety and his that he should not be in the home, but we are trying to work within the community mental health setting of keeping him in the home. While at the ER, we attempted to have him placed at Hawthorne. He had been at Hawthorne for 2.5 months previously, and he did well there. He was safe. We were told by Hawthorne that since he had been there, it would not be difficult for him to be readmitted. But on both September 26th and September 29th, he was denied Hawthorne by a third-party agency, Prest, that OCHN uses to determine eligibility for placement into the state psychiatric hospital. This was determined by someone not familiar with our son, our experience, or any background other than what seems to be provided by Oakland Family Services. We previously had been using Easter seals, but changed after he was in residential for over a year. We were hoping perhaps there was a difference. It would have been nice to have communication with the decision maker. The denial stated that OFS indicated the family had not utilized available services in the community, he poses no threat to himself or others, and that the family should use the many community services offered. And that's a quote. There are a great many obstacles to getting the support. Here's the support we've received in this past month since we were last here. We received a letter from OCHN customer service thanking us for our public comment. We have received no CLS or respite other than what our daughter can help us with. We had one meeting with OCHN and OFS on October 3rd. In that meeting, OFS continually stated that we had refused or declined services offered, which was not true. The only time we didn't utilize something is when, as a team, it didn't make sense for his situation. Our son has had one meeting with his caseworker. We have continued to request the following that has been recommended by professionals we work with: CLS, respite, overnight respite, equine therapy, music therapy, trauma-based therapy. We have still not received any of these. It's extraordinarily disheartening to have your son threatening to kill himself or you and work for hours with a community mental health system to get him services. Then that same system tells others that he is stable and you aren't utilizing, and you're actually refusing the many services that are available when there aren't any. This is wrong and unethical. Finally, we're wondering if the OCHN board members will be in attendance on October 29th for the SED service program meeting. Thank you.
Thank you, sir. Do we have any other public comment online or in person?
We do not have any additional public comment in the online form or in the chat.
All right, thank you. We will move on. Director's report, Ms. Lazenby.
Good evening again. First, I would like to thank this board for the support in approving the the benefits for the staff, and including Act 152 resolution. That's one of the things that really does allow us to retain staffing and also recruit. It's a great benefit, and the employees really appreciate it. So on their behalf, I want to say thank you for that. Also, I wanted to update you on a few other things. One is the voting as an advocacy move and self-advocacy, because now we really do focus on the training of the people we serve, as well as exploring training options and support for individuals who work with people we serve. We think that's very critical, that they know that individuals we serve have a right to vote, and making sure that they facilitate that as an option for them. The other thing that continues to be ongoing, and hopefully we'll see somewhat of a relief, is the threats to privatization of the public behavioral health system. So we just encourage everybody to continue to keep that at the top of their priority. We know that many services and supports will be lost with the privatization of community mental health. The other thing I wanted to do is recognize October as National Disabilities Employment Awareness Month. I won't even say the acronym for it is NDEAM. The national observance is meant to educate the community about many contributions individuals living with disabilities bring to the work environment. So I also want to really thank our team for making sure that people are supported in their attempts to provide and find employment and live independently. Finally, I'll refer you to our strategic goals and initiatives on the bottom of the report, and they have to do with administrative and service delivery, which is always something that we are looking at and improving, advocacy, outreach, and partnerships, integrated healthcare initiatives, which is really one of the huge pushes behind privatization, and I think a part of it is not knowing that we do provide integrated care and supports, including housing and transportation supports. Quality system of care is also one of our initiatives, and that means really improving how we collect data and analyze data and use that data to make improvements in outcomes for people. And finally, staffing and retention, and recognizing that staff need all the training that they can get, and that we can make available other trainings that will allow staffing to be more advanced in what they can do to support the individuals we serve. The other reports are basically the numbers of people we served in the various programs. And so if there are any questions, I'm happy to answer those.
Do you have any questions for Ms. Lazenby? All right, looks like we have no questions, okay. All right, thank you. We will move down to board member comments. I guess I'll just ask if there's any board members that would like to make a comment. All right, Mr. Ferrum, and then Ms. Newman.
Yes, I'd like to thank everyone for their continued support in my role as secretary. Thank you for the public comment tonight. We definitely hear those comments, and we will get back to you. And I would like to thank all the staff that puts time into these presentations for the meetings. And I also want to thank Dr. Taub for his service on the board. I know that he always served gladly and served with a smile, and that he will be missed. So, thank you, Steve.
Ms. Newman?
I want to thank the board and the staff for the floral arrangement that we received for my husband's funeral on the 10th. It meant a lot, so thank you.
Thank you, Ms. Newman. Any other board comments? I just wanted to make a statement. I appreciate the public comment last month and this month. Though we can't speak directly to it, I can say that this board is hearing loud and clear the concerns, and I think it is the purpose of the public comment is so we do receive that information. So please do continue to speak in public comment because it is an opportunity for the board to hear. And again, I just wanted to state that Dr. Taub, that it's a loss to lose him, but looking forward to new opportunities for getting a new board member, and looking forward to the chance to have Dr. Taub come at some point to rather get his plaque or presentation or recognition virtually or in person. With regard to the forum, that is something that I think came of the last comments that were made, and I do know that several of us do plan on attending. So that being said, any other comments? Okay. It's reminding everybody to get out and vote on November 8th. It is important. I know Ms. Lazenby spoke to some of the issues with those with disabilities, and perhaps maybe sometime in the future or next election cycle we could have some kind of forum or something. I did see something recently, a forum on for communities getting out there and voting, especially those that have hurdles in front of them because of disabilities, and learning how to tackle those things and educating them on what to do. So, all right, appreciate the opportunity this evening, and this meeting is adjourned. Thank you.